Dental professionals have the ability to save lives, prevent debilitating treatment and surgeries, allow people to be able to speak and eat, and to live a pain-free life. You have this power by performing oral cancer screenings twice a year on every patient in your practice. Don't let your patient who trusts you become a sad statistic. Hi, I'm Robin Morrison, co-founder of Oral Cancer Cause.
And I'm Linda Miles, also co-founder of Oral Cancer Cause.
After having been in dentistry for many years, Linda and I came together because we both lost a loved one about the same time to oral cancer. I lost my brother after he battled for 5 years suffering from oral cancer. I never want to see anybody go through what my brother went through. If he would have been diagnosed and treated at the early stage, he would be here today.
I lost my sister-in-law, Charlotte, who battled for about 3 years after her diagnosis. She was told by a dentist to go to an oral surgeon about 7 years before she actually died, and she was one of the patients that was fearful of the diagnosis, so she chose not to go. By the time that she did have her surgery, which was 5 years later, she suffered a lot of treatment and a lot of agony with her disease, and by the time she passed away, it had spread throughout her entire body. Again, Robin and I don't want anyone to have to suffer with this debilitating disease, and therefore that is why we've started Oral Cancer Cause. One person dies every hour from oral cancer, and more than 40,000 people per year are diagnosed. The high risk used to be the elderly people who smoked and drank, and those who use smokeless tobacco. In the future and today, the high risk are the 20 to 40-year-olds due to HPV. Oral cancer is not only devastating to the patient, but to their entire family. We're very proud of the fact that Oral Cancer Cause is the only foundation that provides financial assistance to the families of those who are unable to work due to oral cancer treatments and the follow-up. We depend on dentists, oral surgeons, radiologists, and oncologists to provide us with the names of patients, and we are very proud to say that 100% of our profits go to this worthy cause. The benefit of early diagnosing is that the patient is relieved of the stress of more debilitating surgeries and radiation and chemo, and early diagnosis is the only way that we can continue to save lives.
Hi, I'm Dr. Jeff Blackburn. I'm a dentist in Midlothian, Virginia. The purpose of this video is to demonstrate how we do an oral cancer examination in our practice. The way our examination starts is to take a thorough medical history and to ask the patient the appropriate questions. Our patient today is Gina, and so I'm going to start and do that examination on Gina at this point. So Gina, do you have any sensitive teeth, or have you had any changes in your mouth that you need to tell me about?
No.
Okay, great. And now I'm going to go ahead, after that question, I'm going to go ahead and start my examination on Gina. As you know, I will normally have a mask on, but for the purpose of this video, I will not. And the first thing that we're going to do is we're going to do an extraoral inspection and extraoral examination. And I'm going to be looking at the extraoral structures around the lips to make sure that we don't see anything that has been growing, any ulcers, any sores. I'm also going to go ahead and do a tactile examination and check the lymph nodes along the neck region. After I'm done with that, I'm going to have Gina open wide, and go ahead and open as wide as you can and stick your tongue out and say "ah."
Ah.
And while I'm doing that, I'm going to press down on her tongue with my mirror so I can actually visualize the back of her throat. And then the next thing I'm going to do is have Gina, could you stick your tongue to the left? And I'm going to now visualize and inspect the right posterior lateral border of her tongue, as well as underneath the tongue on that right side. And Gina, if you could stick your tongue to the right. And now I'm going to do the same thing with the left side and look at the left posterior lateral border of the tongue, as well as looking underneath the tongue. And Gina, if you could stick your tongue to the roof of your mouth. And now I'm looking at the floor of the mouth and the backside and the gingival region. And Gina, if you can now bite down. And now I'm going to go ahead and look at the cheek and the inside there. we tend to see for patients with lichen planus where this is an area where we will tend to see a lot of striations. I have had a couple of cases that the patients with lichen planus, it has turned into squamous cell carcinoma. We also will inspect right here in the buccal vestibule. And when we have patients that are chewing tobacco and putting the dip in here, they tend to see this is the region where they are going to be developing the cancerous lesions. And that ends our oral cancer examination. As you can see, it does not take a long time to do a complete and thorough examination. In fact, in our practice, it usually takes less than 1 minute to do everything that we need to do for this examination. I hope this video has helped you and our patients in our fight against oral cancer.